Say this year it's more important than ever to get a flu vaccine. The founder and CEO of Ms. Medicine, Dr. Lisa Larkin, told us that shot can prevent more than just the flu. Dr. Lisa Larkin, thank you so much for being here. So we've been hearing for weeks now that it's especially important to get a flu shot this year in particular. Why?
So this is really, really important to talk about, and I am all over with my patients talking about the importance of flu vaccine and pneumonia vaccine and making sure that all of your vaccinations are up to date. Why is that this year? Well, obviously, we all know we're in the middle of the COVID-19 pandemic, and I will tell you that a combination of influenza this year, plus COVID will increase your risk of serious complications and hospitalization. The other thing that's very, very important is that flu vaccine is safe and it prevents you from getting flu. Now, I hear from patients all the time they don't want to get the flu vaccine because it makes them sick. It is not a live vaccine. The symptoms that you have when you get the flu vaccine occasionally are your body's response to the flu vaccine to generate the antibodies that are needed. It's really important that we vaccinate a large swath of the population because, as we've been talking about with COVID-19, developing a large number of people that have protective antibodies protects all of us. This is the concept of herd effect. And as we know, the flu vaccine or the influenza season, when it's bad, can result in 35,000 deaths across the United States. And if we add the increased number of people who require hospitalizations with flu vaccine to the number of people who need hospitalizations with COVID, we will also increase the chances that we're going to overwhelm our healthcare system. And so for your own protection, for the protection of others, and for the preservation of our healthcare resources, this year, like no other, is it time for everyone over the age of 6 months to get a flu vaccine.
Well, Lisa, you mentioned the herd immunity and how important it is not just to protect yourself, protect others, which is what we've been hearing with COVID. But I just read this week that testing for COVID-19 could be more complicated during flu season. Why is that?
Well, so we are all looking to have point of care testing in our office. I'm hoping to have that very, very soon in my office, where we can check for the presence with a nasal swab like we've been doing for years with influenza to see whether or not you have COVID and give you a result immediately versus influenza A or influenza B. And that will be a game changer if we have that. Now, the problem we've talked about with antibody testing and with diagnostic testing for COVID for months and months and months now is that no test is 100% perfect, right? So we worry about both false negatives and false positives, and the problem with potentially, although we haven't seen this yet, difficulty in distinguishing on the tests between COVID positivity and flu positivity. And obviously that's really, really important. But again, we're going to see how things go this flu season.
Yeah, one last question is all I have time for. Another good thing about the flu vaccine is it can decrease your chances of getting Alzheimer's disease. But you also have some new information about a possible test for Alzheimer's coming down the road.
Right. So this is really, really exciting. As a primary care provider who sees lots of patients who come in complaining of my memory is failing, who is worried about whether or not they're developing Alzheimer's. The problem for us as primary care providers, we don't have a great diagnostic tool right now. It's a clinical diagnosis based on history and cognitive decline. We can use imaging, and certainly lumbar puncture with looking for specific Alzheimer's proteins can be helpful, but that's not common and easy to do for all patients. The good news is it looks like now from a large study, a series of studies published in JAMA, is that we are getting closer to having a serum blood test that would help us identify people who are going to develop Alzheimer's, and that may be available in the next 2 to 3 years. The other thing we've just learned, which is really exciting, is that both flu and pneumonia vaccine appear to have a protective effect on the development of Alzheimer's. So again, if there's ever a time to get a flu vaccine and get your pneumonia vaccine, it's this year for both prevention of your own illness, preventing illness in others, saving healthcare resources, and preventing Alzheimer's.
Dr. Lisa Larkin, thank you so much for that great advice and for your time today. And a reminder, doctors say get your flu shot between September 15th and October 30th.
Thanks, Sheila.